I'm Dr. Channing King, and you've gotten this video because you or somebody you know and love suffers from some type of thyroid condition. What I'll talk to you today is about how you can get your life and health back through metabolically getting healthy, through functional lab testing and functional nutrition, and through neurologically getting healthy, through getting your brain that controls your body, through your spine and nerves, the function of your body better. Now, I know that sometimes you think that a health condition like thyroid just kind of jumped up on you, but what tends to happen is that you're unhealthy first, then you develop some type of thyroid symptom condition or some other type of health problem. And what most people try to do is to take a medication for it. And I know some of you that are watching this, maybe you haven't gotten the results that you'd like to get, and that's typical. But even if the medication took care of your thyroid symptom problem, health problems, you still have the unhealthy body, so you tend to develop some other type of symptom or problem. Then you tend to take another medication, and even if that takes care of it, you develop another symptom or problem, and you take another medication, where you get to the point where you're taking multiple medications, but you still have an unhealthy body. And what I want to teach you today is that how you can get a healthy body to help take care of your thyroid symptoms and your health problems so that you can truly get your life back and get to the cause of the problem. That's important. A little bit about me. I've been a chiropractor for a while. I really always strive for clinical excellence, but I started learning with chronically ill people, with thyroid conditions, how important the brain is and how it all starts there. So I started learning neurology and studying chiropractic neurology and how that affects your brain and nervous system. And I started realizing too that most people metabolically aren't getting the right test, meaning enough tests to really check the thyroid, to check their metabolic health. So I started learning, functional blood chemistry and how to read lab work from a functional standpoint to get you healthy there. And I started consulting. You can see there, Dr. Michael Johnson that wrote the book, What Do You Do When the Medications Don't Work? And he's a chiropractic neurologist, but I started consulting with about 450 doctors all across the country that specialize in helping chronically ill patients, like people with thyroid conditions like yourself, how you can get your life and health back. So this book from Dr. Karazian is a great book to read on thyroid. Why do I still have thyroid symptoms when my lab tests are normal? That's the picture for a lot of people. This book has a lot of great stuff on just thyroid health, a lot of great stuff on just how to get your body better so that you can live the life that you want to, but I recommend you purchasing this book. It'll help along the way. I want you to really take note of this slide. Chronic health conditions have common threads. You obviously, if you're watching this video, you or somebody you know has some type of thyroid condition, but a lot of times along with that, you might be a diabetic, type 2 diabetic. You might be insulin resistant. You might have some type of balance disorder, some type of pain like sciatica or neck pain or back pain or stenosis or some type of stomach problem, IBS, colitis. You might be autoimmune, whether it be rheumatoid, Crohn's. There's a lot of autoimmune problems. Maybe you're a person that you have infertility, or maybe you have some type of attention deficit disorder or spectrum disorder. Whatever it is, I really want you to catch this, is that if you have a thyroid condition, you either know you've developed some of these other health conditions here on the left side, or you're in the process of developing those until you figure out what's the driver. The driver for all these health conditions, this common thread, is: are you metabolically imbalanced? Are you neurologically imbalanced? That's really the key, because looking under the metabolic imbalances, when you're anemic, when you don't have enough oxygen, it's going to affect your thyroid. It's going to affect health and cause other chronic health problems. Obviously, your adrenals are big. They actually tie in with the thyroid. They're both glands, so when one's off, it affects the other. You're going to learn today when your insulin and blood sugar's off, that affects your thyroid. That affects chronic health problems. One big thing I see in a lot of patients, I notice that they have some type of hidden infection or food sensitivity, whether they have a parasite, a yeast, a mold, or they're sensitive to gluten, soy, milk, eggs, or foods are cross-reacting, and a lot of them don't even know that keeps driving their health problems, affecting their health, until they really get tested. But until you get that working better, it's going to continue to affect your thyroid, continue to affect your health. Maybe you have some type of hormonal imbalance, and that can definitely happen if it throws your glands off. Or maybe you're autoimmune. There's a lot of different types of autoimmunity to where your immune system's off kilter. And some of you are taking thyroid medication, and it's not your thyroid that's the problem, it's your immune system the problem. You're imbalanced there. So we have to actually test that to see. Maybe you're inflamed. Sometimes you can be inflamed in your stomach. And again, you'll learn how that affects your thyroid, but it can spill over out into your joints or into your spine. You start feeling that because of it. So what happens is that when you're metabolically imbalanced, the stress on your body affects the function of your brain, and it starts not firing like it should. It starts fatiguing like a muscle. When your brain fatigues, there's really not a health problem that's off limits because your brain has to get the signal. You heal from above down, inside out. So if this is fatigue, the message can't get to your body. Kind of like if you cut my brain off to the body, the message can't get there, and it's fatigue. There's less of a signal because of the metabolic stress. So know this. The key to this slide is that if you're metabolically imbalanced, neurologically imbalanced, it's going to affect your thyroid, affect other chronic conditions, whether you know it or not. And it's a lot like if your car, the oil light comes on, you pull into the gas station, you can put oil in it, drive off, things go well for you, car works great. You can get a marker and just cover it up with a black marker, the light, drive off. Yeah, you've done something to remove the light, but you're going to have the car's going to have a breakdown. Same thing with your body. A lot of you taking medications, there's a place for it. In this instance, a lot of times there's some natural things you can do, but you have to figure out what's causing your body to break down so you don't keep covering up with medications and have a breakdown or a total breakdown. So all cases are neurological, metabolic. Metabolic imbalances, stress in your brain and nervous system causing neurological imbalances. This is the whole reason I got into helping chronically ill people with thyroid, is because most people don't know what's driving it, what's the cause of it, and it is metabolic, neurologic. We just got to test you, figure out what's going on. That'll really help your life and health. So let me prove it to you. In metabolism, you eat food, hopefully good food, healthy food as much as you can. If you're sensitive to certain food, you might have to cut that out for short term, maybe long term, depending. But you eat food. Your body should function well enough from you eating food, digesting it, moving through your body to where you get energy. And you need energy for your thyroid to work, for you to be healthy, you need energy. A question for you is that 30% of our energy goes to what system? Now, when I teach seminars, people give me all the answers. The one that they rarely give me, though, is the right answer, and it's the nervous system. It's really the key. It needs energy. So this is why your metabolic system has to be healthy to give you energy to your nervous system, because your nervous system controls everything. Like I told you, that if you cut the brain off to the body, it stops. In the hospital, they see if somebody has life because of brain waves. The brain's very important, and it has to get the signal out your spine and nerves to tell your thyroid, any gland, muscle, organ what to do. If you look in any anatomy book, it'll tell you that the nervous system controls and coordinates everything. You can see how it's connected. But one big thing for the thyroid is that you need proper metabolism, you need energy, so that your thyroid can work well, so that it can connect to your brain well. If you look at the bottom of the slide here, it says the thyroid and an arrow-brain connection, because if your thyroid's off, your brain's off. If your brain's off, your thyroid's off. You might not like to hear it, but you have thyroid cells all through your body, including your brain. So if you have thyroid problems, you have noggin problems, you have brain problems. So for me to be able to help you efficiently, we do have to look at the thyroid, make sure that's tested like it should be. And we have to look at the brain, because if you don't, you're just not going to get to the level of health that you should be. It's connected. So here's some thyroid symptoms. I won't spend a lot of time on this. You can go through these, but some of you have experienced fatigue or weight gain or temperature changes or constipation, or just the ability not to really handle cold and heat like you should, or heal like you should. Maybe your hair's been falling out, or the outer part of your eyebrows are falling out, and you've just noticed changes, and your life and health isn't where it should be. So these symptoms you can go through, and this is just a sign that maybe the thyroid's the culprit. So you can take a look at that. Know this, that your thyroid supports a lot of things. So a lot of times we think, well, I have a thyroid problem, it's just my thyroid. But you got to realize, if you don't really unlock the key to the mystery of why you're having these problems, the thyroid is just not affected, but it's affecting other things like bone metabolism. A lot of times you can have osteopenia, osteoporosis, bone weakness with thyroid. Your immune system can be off, and that can drive a lot of other chronic health problems because of it. Maybe your brain and nervous system we know is off, but maybe with that your endocrine system, adrenal glands, ovaries, testes, all that can be off, and that can really, when your hormones are off, can really cause your body to work out of line. your gastrointestinal function in your stomach, a lot of your immune system's in your stomach, and you're going to learn how important your stomach is, but your thyroid affects that. Your stomach affects your thyroid, vice versa. Liver and gallbladder, we filter everything through our liver, and your thyroid's off, it affects the liver. When the liver's off, it affects the thyroid. We talked about hormones, fat burning. You might be a person that you've tried to restrict your eating, you've tried to lose weight, but you just can't do it, and a lot of it has to do with because of your thyroid and other things going on. Insulin and glucose, your body doesn't like when that's off, and when your thyroid's off, it affects that. Cholesterol and stomach acid. Now, you need proper stomach acid so you don't set up a situation to where you can get infections. Parasitic infections could be bacterial, yeast, mold, and when your thyroid's off, your stomach acid's off. So know this, every cell in your body, including your brain, has thyroid receptors. So it's not just your thyroid. I want you to start thinking less linear to where it's just one thing. Know that thyroid's there, but it connects to other things, it affects other things. So this is an example of crosstalks. Thyroid crosstalks your immune system, your gut, your brain, your endocrine system. So one affects the other. So for you to get better, you do need to assess the thyroid, and a lot of you have not had it properly tested yet. But two, you have to know that if your immune system, gut, brain, or endocrine system's off, your thyroid's going to be off. They work hand in hand. One affects the other. Hope you're getting that at this point. So here it is. I'm not going to make you memorize this today, but a lot goes into this, but I want you to see how the body's affected. And this can really change your life when it comes to thyroid. But what happens is that you see the brain, it actually starts in the brain, in your hypothalamus. So if you'd have a healthy thyroid, it starts in the brain. You'd have good brain health. But the brain releases something called thyroid-releasing hormones that tells the pituitary gland, say, hey, we need to stimulate the thyroid. It's time to get it working. So it releases TSH. This is what most of you have only had TSH, maybe T4 checked. This is what it is. Stimulates the thyroid. The thyroid releases two hormones, T4 and T3. 97% is T4, and it actually cleaves off one iodine and makes T3. But that 3% is the only active form. So you don't have a lot of T3 in your body, so your body needs to work well, so again, for your thyroid in your body to work like it should. This thyroid binding globulin, the TPG here, it's like a taxi cab. It takes the active T3 around your body where it needs to go. The interesting thing, I want you to catch this, is that 60% of this T4 to T3 conversion's in your liver, 20% in your gut, and 20% out into the periphery of your body. So I'd ask you a question. If you're just checking TSH, do you think you're maybe missing a lot? Sometimes you might check T4, but are you still missing a lot? What I mean is that a lot of people are taking thyroid medication or replacement hormones, Synthroid, whatever it is, but the thyroid is not the problem. Could be the brain, the pituitary gland, liver, gut, other tissues. It's kind of easy to see. Or you can see how this connects into your adrenal gland, ovaries, testes, hormones, how it's not just here. We can't look linear. This connects to other places. You have to look at the total picture. So, kind of what we talked about. The brain sends a signal to the pituitary gland, releasing hormone, TRH, to tell it, hey, we got to stimulate the thyroid, releases TSH, to stimulating hormone. And then what happens is that T4 to T3 conversion, and the taxicabs to TPG, that thyroid binding globulin, to send it out through the body. What we talked about, 60% of the liver converts T4 to T3, so if the liver's not working well, you know, how's the thyroid going to work? So you got to make sure that's healthy. You got to test that to know where it is. 20%, you got to have good gut flora. Look for infections in the stomach, which a lot of people have. Maybe in the stomach you have a battle because you're sensitive to foods, but 20%'s there. And 20%'s out into your cells in your body is converted T4 to T3. So that has to be healthy. So you have to look at those. So have you been tested? And one, if you're tested, has your doctor told you you're normal? And you probably hear this a lot. This happens a lot. People have been tested and they say, yeah, they check my TSH, maybe my T4, they tell me I'm normal, but I don't feel normal. I'm not functioning normally. And that happens a lot because what happens with lab ranges that they check medically is that they're very wide. So you have to fall in this wide category to be considered sick because they test it off a bell curve. So everybody that goes into the lab last year, you have to compare to those people and be sicker than those people to be sick, if that makes sense. You have to be in that category. we look at that, but what's real important so you don't miss anything is to look at you functionally too. Every marker has a functional, more sensitive, more narrow lab range for that area of your body that's been tested and researched to make sure that area is functioning well. So this is an example. You actually, again, have had lab tests, but you have to be in the reds there, meaning that you have to be abnormally low or abnormally high to be considered sick. A lot of people, and probably you fall in this category, to where you're in the green, you're not quite low or high enough, but there's still, we want you to be in that blue functional range, but you're outside of it, so that area's not functioning well, but you still feel lousy, have health problems because you don't really know there's a problem because nobody's told you that or tested and looked at you functionally yet. So this is how this works. Let's take glucose, for example. So the traditional range, wide range, is 65 to 110, very wide. So the functional range is 85 to 100. So let's say your number's 73. Again, if you went in, they'd tell you you're normal medically because you're within that 65 to 110 range, but look at the functional range, 73, you're actually hypoglycemic. And again, when your glucose is off, it really affects your brain, your nervous system, your glands, your thyroid. So that would have been missed. You really had to look at both of them. TSH, this will hit home. Wide range, 0.3 to 5.7. Narrow range, 1.8, the functional range, what we really want to look at, 1.8 to 3.0. Let's say it's 4.2. Again, medically you'd go in. Again, very wide, you're in that range, 0.3 to 5.7, so let's say you're normal, but you still feel lousy, still functioning lousy, because you're out of that 1.8, 3.0 range. It's at 4.2, so you have high TSH because pituitary gland's trying to stimulate your thyroid, and it's not working. So we'd have to be able to catch that, and for a lot of you, it hadn't been caught. So there's a few more examples you can look at, but I think you get the picture. So a true functional test would be looking at maybe 7, 8, 9, maybe 10 markers. I know for a lot of you, you've had TSH and T4 checked, but to get a real good assessment of your thyroid gland, it has to be more of that. You can kind of remember the chart I showed you of how the thyroid and all that works with the brain, but you really got to look at more than just one or two things to see where it's coming from. So typically medically, don't get me wrong, I know I'm saying a lot about medically this and that, is that they have their place more for emergencies, but for chronically ill situations like thyroid, just doesn't work well, because just looking at TSH, T4 rather than 7, 8, 9, 10 markers, you got to think who would be the better detective to find out what's going on. And for a lot of people, their thyroid gland's being burnt out from hormone replacement, from thyroid medication, because it's just an old model. It's a 50-year-old model, and if you don't need it, it really can affect you. Chemicals are rough on your body anyway. So the key is again, finding the cause of the problem, getting you better so you can get your life and health back. So Hashimoto's or Graves' disease. Now these are autoimmune problems with the thyroid. Affected, but it's not the thyroid that's the actual problem, it's your immune system. So this immune problem, a lot of people are taking medications for a thyroid problem, which the thyroid is the culprit, but the main cause of it is your immune system. So you had to address the immune system through proper testing. Most people hadn't had the proper testing yet. So the immune system is very important to your thyroid. And just a little bit about the immune system is that you have natural barriers, kind of like a house does. It has walls, windows, a roof to keep things from coming in. Your body has the same thing, and your skin, lungs, eyes, mucus, and gut flora to help. So invaders, pathogens, things, and don't come into your life or into your health. There's a couple parts of the nervous system, or excuse me, the immune system, that the Th1 and Th2. The Th1 is, if you think of a battle, they're the ones on the front end defending, try to help fight for you so you can stay healthy through your immune system. The Th2, they're more the ones in the battle that as people go by, they tag them, say with a fluorescent color, so that you can recognize them later so your immune system can fight that invader later. The Th3, they're more of the generals in the back, telling, hey, Th1, Th2, go here, do that, fight this, fight that. And that's important because a lot of things can invade your health and life. But the problem when you have something like Hashimoto's or Graves' disease, it can affect your thyroid, but also the Th3 gets to where it's failing, to where it can't tell the Th1, Th2 what to do, and the Th1, Th2 just become imbalanced. So you really got to work on getting that scenario better if you're ever going to get better. So this is a look at it. When the body attacks itself, this could be going on with you. One, the Th1 or Th2, it's hyperfiring. There's one that's dominating the other, so the balance isn't right. It should be balanced. When it's like this, your body goes haywire, and it not only can affect your thyroid, which if you have Hashimoto's or Graves' disease, it already has, but it can affect other tissues because your body's not understanding self, it's actually attacking it. That's what it's autoimmunity against itself. So you released these things called cytokines. You don't really have to memorize all this, but just so you know. And these are just messengers letting you know that there's tissue destruction going on because of the out of balance of your Th1 to Th2 in your immune system. So how does this happen? This will make a lot of sense to you, is that one, you're dysregulated. You eat too many inflammatory foods, omega-6 fatty acids instead of omega-3. That's common in America, to where you're chronically inflamed and it's driving your immune system, driving your health problems. Your blood sugar's off, which affects a lot of things, including your thyroid, your adrenal glands, which if you have trouble sleeping, energy levels, blood sugar, your adrenal glands, brain play a big role in that, including your thyroid. Hormones, obviously we've talked a lot about the brain and the nervous system. Pregnancy can dysregulate you, where you can have thyroid problems where you didn't have it before you were pregnant, and vitamin D levels can affect it. So something's dysregulating. We have to test it to figure out what it is. The other thing is that you could have an active antigen. This is an invader. It could be an infection, a bacterial viral mold, could be a parasitic infection, some type of infection in the gut a lot of times. And a lot of times people don't say, well, I don't feel anything. You don't feel a lot of pain fibers, really aren't a lot of them in your stomach. So a lot of times you don't feel that, but it can spill out into your periphery, into your joints and spine if it's there. You're sensitive to foods. That can actually cause an antigen to where your body can attack itself because it doesn't like those sensitive foods or the foods that are cross-reacting. Toxins from the air, from what you drink and eat, can cause an antigen or a fight in your body. It could be leaky gut, and we'll talk more about that, but to where the junctions get loose. And this is a big thing with autoimmunity, to where instead of you digesting food down to, say, penny size, you actually digest them down to quarters, and they pass through because of infections and food sensitivities. This is, again, weaker. And then your body doesn't recognize it, starts attacking you. And it could be your thyroid, like it is with some of you watching the video, or it could be other things. But you have to test for it. You can see how, to be a really good detective, it makes sense to really look at the physiology of your body, see if you're dysregulated, see if you have an active antigen or invader, and figure out why it's happening. So your autoimmune system, when it attacks it, it's interesting that, I won't spend a lot of time on this, but it goes from tissue destruction to more severe tissue destruction the longer it's there. It's called interleukin-17 cytokine, and that's something you can actually pick up on testing, but it actually shows you there's more destruction. And then as it goes more, this cytokine-induced nitric oxide system causes more severe tissue destruction, and again, your body's fighting, and before long, think of a battle. If you just keep getting pounded and pounded and pounded, other things are going to be affected more than just the thyroid, so you have to regulate this. With autoimmunity, there's really not a natural cure for it when you are autoimmune, but like a light, you can actually dim the lights. It's not so bright, so you can live life and health better, where you can actually function and do a lot more than you did before, feel and function a lot better. But almost always you have a leaky gut, to where things are passing through that shouldn't, and we have to tighten those, test for it, tighten those junctions, because if you don't, again, you can see on this slide your Th1, Th2 is imbalanced, and you get tissue destruction, more severe tissue destruction. And through functional lab testing, nutrition, functional neurology, there's a lot of things you can do to help get your body regulated to stop this attack. So for Hashimoto's and Graves', there's some things you can do. One, you have to find out where's the antigen, where are you dysregulated. Work on getting that better. That really helps. Modulate the immune system. There's certain nutritional things that you can do to help your immune system fight better and balance out, work better together. And you just got to make sure you're tested. Most people hadn't been tested, but if you know it's the immune system, not the thyroid, that really helps a lot with getting you healthy. So I want you to pay attention to this. I want to spend a few minutes going through this. This is the 6 major thyroid patterns. Now this can really save and help your life. Is that most of you fall within one, probably multiple patterns, but only one of them has the chance of helping you medically. So catch that, one has a chance of helping you medically. There are some natural things that you might still can do in the one that does have the chance of helping you medically. But the 6 major thyroid patterns, the first one is primary hypothyroidism. This is the one that has a chance of you taking medication and it'll help you, because what's happened here is the thyroid gland's gotten lazy and the pituitary gland's just trying to just kick it into gear, saying, hey, wake up, you need to work. And TSH is high because it's trying to stimulate it. And with this problem, is the only one that hormone replacement therapy medication has a chance of helping if it's just because the thyroid's the problem. Unless you have Hashimoto's, autoimmune problem we talked about, you actually could have high TSH with that. A lot of people are taking thyroid medication and it's actually not the thyroid causing the high TSH, it's your immune system, it's the Hashimoto's going on in your life, so we'd have to test for that. This is a lot like if the light went out, we put a bulb in, light came on. So the bulb was the problem. In this pattern, the thyroid's the problem. You can see each of these slides, some natural things on the right-hand side you can look at. Number 2, hypothyroidism due to secondary pituitary hypofunction. So on this one, the thyroid's fine. The thyroid's not the problem. It's your pituitary gland has gotten lazy. So the pituitary gland, TSH is low because it's not sending thyroid-stimulating hormone to stimulate the thyroid because it's asleep. It's not doing its job. And this can happen from stress and fatigue, from glands, it can happen from the medication you're taking, Synthroid, hormone replacement therapy, especially if you're taking it, say you're in pattern 1 and you don't need it and you're taking it, it can affect your pituitary gland. Estrogen, depression, even pregnancy, this is one thing that can happen to where the pituitary gland can fatigue during pregnancy, or the fluctuation of insulin and glucose, because how that affects your brain and body and how it can affect your adrenal glands and fatigue. So it doesn't really make sense, I hope you're getting this, is that to be taking medication for your thyroid when the thyroid's fine, it's the pituitary gland and all these other factors that we went over. This is kind of like the light's out, we're trying to put a bulb in, but it's not turning on. We keep trying to jam it in and try to use different bulbs, jam it in, but the light's never going to come on until you fix the cut wire. The wire is actually the problem. This is like 2, level 2, pattern 2, to where until you look at the pituitary or the wire, you're not going to get your life back, health back, so we have to test for that. Number 3, thyroid underconversion. This is where your body's not converting enough T4 to T3. This happens with adrenal stress, happens when you have infections in your body or inflammation in your body or in your gut, you don't know it. This is oftentimes missed because low T3 doesn't really affect TSH. So medically, if they're just looking at TSH, maybe T4, they don't really test for this. So this could be your problem, but you don't really know it. So this is like the circuit breaker is the problem. So again, you wouldn't want to put a bulb in, fix the wire. If that's fine, you'd want to go to the circuit breaker. So a lot of you haven't really checked the circuit breaker or the area of your body that's under converting T4 to T3 to really know what the true cause is. Next, number 4 is thyroid overconversion or decreased TPG, thyroid binding globulin. This is where you have too much T3, too much T4 to T3. And this is a thing kind of like too much oil in your car. It's good to have oil, but you don't need to have too much. It can cause problems if you have too much. So in this one, there's too much. And this has to do with a lot with insulin resistance, especially in women, or cells that have gotten to where they're not listening because there's so much insulin. You're bombarding your cells with insulin trying to get glucose into the cells from your diet or the function of your body to where it stops listening. Kind of like your boss that keeps yelling at you. Eventually you stop listening. Your cells do that, and this is where you are. Testosterone levels can go high in females and can affect this, but we have to do the right testing to know that it's away from the thyroid, and we have to see what's going on to help you in this pattern. Number 5 is thyroid binding globulin is elevated. There's actually too much of it. So what thyroid binding globulin, what it does is that it actually takes T3 through your body, but when you take oral contraceptives or some type of estrogen replacement therapy, it can lead to increases in TPG. And it's kind of like the cars with the child safety lockdowns. There's too much TPG, so it's trying to hold on to T3 because there's not a lot of it, so it's not letting it out into your body, the active form of thyroid hormone you need out into your body. It's holding on to it. So you have to actually test. Most of the time people don't get their TPG or another one, TPO, check to really see where that is, see where the problem is, but you're not get better till you really check that pattern. Next pattern is level 6, the last one. You're thyroid resistant, meaning your pituitary and thyroid, they're fine. So it's not a problem there, but through stress, through adrenal issues, through cortisol issues, your cells have just become overloaded and they're not really taking in what they need to take in, and you become resistant to the thyroid hormones. We'd have to see again and test, see where that is. So I hope your eyes are enlightened after looking at those 6 patterns, that again, we can't just look at your thyroid. We do want to look at that, but realize most of these, 5 out of the 6, the thyroid wasn't even the problem. It was just affecting it indirectly. So we got to look at that. So what we want to do in our office is to really get a good game plan, really test you well, to look at everything. So some of the main metabolic tests we do is that we want to do a complete metabolic panel, to where we want to be a good detective. We want to be able to find out, do enough markers, maybe 7, 8, 9, 10, to really get a good look at your thyroid. Look at antibodies to see if maybe it's your immune system's the culprit, Hashimoto's, Graves'. Look at vitamin D levels, that's really huge for thyroid. See if you're anemic with oxygen levels. See if kidneys affect the liver, and the liver is huge with thyroid. Just look at your organs, see how everything's doing. Adrenals, that's huge, ties into it. We have to test that. There's actually a saliva test that we send off that lets us know, actually gives us a rhythm. Because when you wake up in the morning, you should be full of energy, and then as the day goes on, just kind of lose that energy, then just kind of slip into the sheets and go to bed. That's how it usually should work. When that pattern's off, it affects the rhythm of your brain. It also affects your blood sugar, your melatonin, actually affects your sleep, and affects your thyroid. So we have to check for that. The next one, the Cyrex lab testing you see there, is probably the most advanced testing. Leaky gut's huge for thyroid, huge to see if you're autoimmune. And we have to see how you're doing. 2, we have to see if you're sensitive to gluten, soy, milk, eggs, or cross-reactive. Checks a good bit of foods to see if you're cross-reacting, affecting your thyroid, affecting your health. And then the last one, most chronic people, like I told you, they have some type of gut infection, some type of parasite, yeast, mold, maybe not enough good or bad flora in their stomach. And that, again, from what you've learned, a lot of the T4, T3 conversion happens in your stomach. So we have to assess that. So these are vital tests to you getting your life back. Like that, it's really crucial. You have to do the proper testing. So the triad of Hashimoto's, there's things you look for. Antibodies for TPO, TPG, that lets us know if your immune system's fighting against itself. Gluten sensitivity, if you're that, every time you eat gluten, it's like a battle in your immune system. And you can develop anemic patterns, particularly pernicious anemia there. It lowers your B12, so we have to actually check these things. If you're autoimmune and you leave it there, it typically affects other tissues because they're having to fight too, and you can see it in your pancreas. You can see it in myelin sheaths, to where you start noticing peripheral neuropathy, to where you feel pain out into your legs or feet, your arms and hands, maybe with numbness or tingling. And the most severe thing is that it can actually affect your brain more and more over time. So doing the right test for your immune system with Hashimoto's and Graves' disease is really important. So gluten and leaky gut, this is how this works. When you eat gluten, or if you're sensitive to foods that they kind of look like gluten, so it works the same way, but your body releases a protein called zonulin, which controls your gut permeability. So that zonulin, if you eat foods that you're sensitive, it'll start loosening your intestinal lining over time. And then what happens, like I told you, is that those undigested foods, where the pennies passing through, quarters are passing through, and your body's thinking, what in the world is that? So it starts attacking it, releasing it. The cytokines, that whole process I showed you, that's how it works. Food is able to pass through the gut, the leaky gut. Kind of like in the summer, if you had a cut in a window or maybe in a screen, bugs start coming in. Especially women in the house, they probably start going crazy because they want all the bugs out. Well, your body does it, doesn't look right, so it starts attacking it. This is huge for thyroid, huge for your health. So what makes our office different probably from what you've seen, and probably different after watching this video, is that really we want to help you neurologically, metabolically. We want to get to the cause of the problem, leave no stone left unturned, and that's important. That's really the passion behind me helping chronically ill people with thyroid problems. Is most people don't really realize, again, what's going on, how to be tested, how to get better, and they just keep going downhill, because they haven't taken the proper steps. So that's what we want to do for you, to take the proper steps. So these are some things that we do. Obviously, we need to look in lab testing, your gut, thyroid, adrenals, liver. If you're anemic, if you have sugar regulation problems, if your autoimmune regulation's off, that's going to affect your thyroid and health, so we have to test that. That's really important. We do that through functional lab testing, and a lot of times we help alter your diet or get you on nutritional products that'll help get these things online as we're working on your brain and nervous system. So the comprehensive checkups we do, there's certain neurological tests I do to assess how the metabolics have stressed the brain and nerves, to see how they're doing. There's certain metabolic tests that we've talked about that we do to assess your body thoroughly to see how it's doing. And one big thing that people, again, I want to stress, that don't really realize is that why do you do brain-based therapy, and why is it different? How does it work? And you know this from the pathway I just showed you of it all starts in the hypothalamus, that slide I showed you. Again, it starts in your brain. Your brain controls your thyroid. It controls everything about you. So it's very important when your metabolics are off, and they are with thyroid problems, that we do some therapy on your brain and find out where it's misfiring and throughout your nervous system, since that's where the control is. So the body-brain connection, know this, that your brain's an organ, a sensory organ, and it just perceives everything. So you're walking around, you're doing everything through your day, and just know your brain perceives that even when you're sleeping. And then you react to it through your nervous system, but it's just a big receptor, your body is. And it's really important for your brain to stay alive and have input and to be healthy. It needs a couple of things. It needs fuel in the form of glucose. That's why your glucose levels, we have to look at those to make sure that's where it needs to be. And it needs oxygen. As you get older, you lose oxygen. Particularly, we're going to talk about in your cerebellum, you lose oxygen as you get older. And if you don't replenish that, sometimes I have to put people on oxygen therapy. It's going to continue to cause neurodegenerative health problems later and continue to affect your thyroid. But with receptors, you have receptors in your muscles, your joints, your skin, your eyes, your nose, your mouth, all throughout. But the two biggest receptors that help you and light up your brain, the answer is touch and gravity, what you're touching and where you are. And when we look at the brain, there's a few parts of the brain. One is the cerebellum, which is on the back, kind of the base of your head. And then on each side, you have two hemispheres, a left and a right cerebrum or brain on each side. And then a little bit lower down, starts a little bit above the cerebellum and works its way down is the brain stem. These parts are important for your thyroid, important for your health. So the cerebellum there, you can see that left hemisphere, and that's actually the brain stem. Now, what happens, how the brain works, and this is important, is that when you do anything, when you have sensory input, it first goes into your cerebellum. The cerebellum actually, when I test people, I can see where you're weak with this, but the cerebellum fires to the opposite side. It crosses over the opposite side of your brain. You have different lobes here of your brain, and then it should break or slow down your brain stem so you don't become too sympathetic to your sympathetic nervous system. What's happening with you probably with a thyroid condition, this is typical in chronic conditions, is that your sympathetic nervous system's firing way too high, and it's causing health problems. It's going to continue to cause health problems until it's slowed down. If you're running from a bear or somebody broke into your house, it's okay to get a little sympathetic, but just going through your day or sitting at home or work, your sympathetic system shouldn't be driving high. It's going to cause a lot of health problems. So we gotta assess those areas. Cerebellum, again, crosses over to your brain, and you see why it's not slowing your brain stem down. So if you do become too sympathetic, you might be experiencing some of these, or you might, in the future, if something's not done about it, you might have pain or fatigue or stomach issues, or a lot of women have urinary tract infections and they're recurring, or they have pain problems throughout their body, might have been diagnosed with fibromyalgia, headaches. You walk around kind of like Bigfoot because your cerebellum and brain's not where it needs to be. Your adrenals have issues, and when your adrenals off, your thyroid's off, but the sympathetic nervous system affects that more. And if it continues to happen, kind of like if you saw a bear, how you'd sweat more, your heart would race, you might get dizzy. Those things can happen, but this happens just in normal routine. You notice this. Cold hands and feet is a sign of thyroid. Sensitivity to light and sound is a sign of adrenal issues. So you can see how when this overfires, how it connects and affects those things. Cerebellum fatigue. If you notice loss of balance, like you get up from the chair and you lose balance, or you close your eyes, lose balance, or you become clumsy, you can't hold things like you used to, you can't organize your thoughts, you walk into a room and you don't remember why you're there, what you're supposed to do, that's signs of cerebellum and brain issues. And the concern is that the more you fatigue your cerebellum, the more it's going to fatigue the lobes of your brain that has specific functions. So a couple quick tests that you can do at home to see if you have a cerebellum fatigue is you can put your feet together, put your hands by your side, close your eyes, and you should be able to stand without swaying around for 5 to 10 seconds. The other thing is that you can close your eyes, keep your pinkies out like this, and try to take the tip of your pinky and actually touch the tip of your nose. And there should be a smooth movement, not kind of away like this, and you should be able to touch and not miss the tip of your nose. If those are just two simple tests, if you fail those tests, then you know there's brain problems. There's other things that we need to look into too, but that gives you an idea. So you can see how the brain works there. The upper brain, the brain stem. Now, when it comes to the lobes of your brain, when you start getting into the frontal, temporal, parietal part of your brain, there's some advanced tasks that they do, and it does affect the thyroid, but it's going to affect your life. And if these brain problems are left, you tend to later can have health problems like Parkinson's, dementia, Alzheimer's, those type things. But we need to really look at this, because in the upper brain, when it gets to the point of being fatigued, you can probably notice your handwriting changing, your thinking changing, your reading, your subtracting, your memory, you might have learning difficulties, you might have lack of focus, and it becomes more evident at that point. You've probably noticed it, especially in your spouse, maybe notice changes in their handwriting, or they're used to not be as irritable, now they're more irritable. They're not as motivated to do the things they used to do, and they can't learn like they used to. That definitely can affect it. So all this happens from stress. Stress is really the culprit. So chemical, what you put in, physical, what you're doing, emotionally, all these stresses fatigue the brain. The brain doesn't like a lot of stress. You're going to have it, but too much is going to continue to affect your brain, affect the nerves, affect the thyroid. And these chemical things happen to where you have, because of the metabolic stress you have, it's going to affect the brain, like what we went over with anemia and checking you to see your blood sugar, your sensitive foods, your immune system, your diet, even prescription drugs. Now they're a chemical stress to your body, and nobody really knows what one, or even when you combine them together, really what they do to your body, but it definitely stresses it. Inflammation, and we talked about infections. Just know that the metabolic problems you have are creating the nervous system and brain problems that you have. So again, we have to look at those. So emotional stresses affect the adrenals, affect your insulin, raise your blood sugar, and we look at your blood work. Typically you have high triglycerides, high LDL, high cholesterol. So we have to work on your adrenals, work on that. It's going to affect your health and thyroid. And again, like it says there, when your insulin and glucose levels are off, it really breaks down the brain and nerves. It just doesn't like those things being off. So we have to regulate that. And one big thing for the brain, as you see here, is good glucose. So to really have a healthy brain, you want to have good glucose levels within that functional range, 85 to 100. You want to have proper oxygen. If you're not getting enough oxygen, you tend to lose it as you get older. We might have to help you with that. And then you have to activate the brain. Might be through exercise, through activation, through adjustments, things to get your brain stronger, like a muscle, to help you get healthier. And that helps your thyroid. Here's some treatments. I won't go through that, but sometimes we might have to do patterns or certain stimulations or certain rhythms or certain adjustments to help stimulate your cerebellum or different parts of your brain to help this whole scenario. So to kind of put it together, neurological breakdowns with metabolic issues, if you look at that, you can see how the pink are some metabolic problems, a few of those. The blue is what gets stressed. Those are a few neurological problems. So we have to test that to see where the problems are. Then what happens is that we have to work with you to make sure we correct what's misfiring, correct the metabolic dysfunctions, put it all together so that you can so you can be strong and healthy, and then retest it to make sure you're on track, and then make sure we treat you as a whole person. Again, we can't just, I hope you get this by now, we can't just look at your thyroid. There's a lot of other moving parts, other components that systems connect to each other. For you to be healthy, we have to actually look at you as a whole person to help you get your life and health back. So what's next? And really, if listening to this, you kind of know that you probably need something different than you've been doing. And you know if this is a route you want to go. And if so, you really just got to call our office to set an appointment so that we can talk to you about how we can help you. And basically, when you come into our office, the first 2 visits, what I'll do is that when you come in first, I'll start assessing your neurological system, your brain and nerves, just to see how that is, how you're doing. Then, if you have labs, you can actually bring those in. If you don't have them, don't run all across town getting them. We'll probably have to do new ones anyway, but we'll get you to fill out a metabolic and neurological assessment form so I can start seeing what metabolic tests you're going to need and what we need to do with your brain and your nervous system. We'd like to give you a copy of Dr. Karazian's book so you can start looking at that. But 2, we're probably going to need to x-ray your spine and see how the nerves come out of the spine, see if there's any shifts in your spine causing nerve pressure, and probably scan your nervous system, see where the pressure's coming from. We'll do that on the first day. Second day you come back and we go through everything. I'll let you know what future metabolic tests we're going to set you up in labs, after visit 2. I'll go over what I found neurologically, structurally, and we'll go over a treatment plan and really what it's going to cost. I highly encourage and recommend your spouse to be with you on that second visit. 4 years are better than 2. And it's real important, especially if you want to get your life and health back, that they're involved in that too, with the financial decision, that they're involved. If there's marital issues, which there can be, that's something that might be different that we can address. So here's my offer. It's normally, for those first 2 days I just showed you, it's $215 to $415, depending on what you need, what we need to do. If you call our office after watching the video, it'll only be $50. But just know that that's subject to change on availability, on timing. So just you need to call our office. The number's there. Just call us and we can get you set up. A few things I ask of you, though, is to accept your case, is that I really want you to make a commitment to make change. For some of you, it's some serious life changes. Some maybe not as much, but just know that if you keep doing the things that you've always done, what happens? You get the same results. We had to do some changes in your lifestyle and get the right testing. Number 2 is just to be accountable for your health. You can't really rely on the insurance or the government anymore. You have to kind of look in the mirror and say, okay, I'm going to make a change and I want to get healthy, and realize that that a lot of it comes up to you. Number 3, know that whatever insurance you have or Medicare, that it's only going to cover a small portion of what we're doing here. Insurance really ain't good at healthy things. They're okay for medicine and surgeries. A lot of people want something to get to the cause of the problem, and when you do that, they just don't cover real well. But we have affordable plans most people can afford. We'll do all we can to help you. Think on this. On a scale of 1 to 10, I want you to think in your mind, how serious is your illness? How serious is your thyroid problem? How's it affecting your relationships, your work, your life? And on a scale of 1 to 10, how serious in your mind are you about eliminating your illness, getting your life back? And are you committed to doing the things that it takes to get you there? And if you are, I'd be more than happy to talk with you and help you. Thank you for watching this video. If you have any questions, you can just email us. Call our office, 205-655-0010, and we'd love to set up an appointment for you and help you get your life and health back. Thank you.